Mr. Jason Greenblatt, good morning, sir.
Hello, how are you? Nice to be with you today.
Well, it seems that America was caught with its pants down and without a plan for the coronavirus, and even the White House wasn't prepared for it.
Well, I think if everybody had known more information out of China, then I think the White House could have learned more about it and how to react. I think the White House, President Trump, the entire team over there with Vice President Pence are doing their best to learn and react daily with each new piece of information that comes out. I have full faith, knowing the team that's there, knowing President Trump for 23 years, that they are doing their best to balance trying to keep Americans safe, trying to prevent the spread as widespread as some predict, and also trying to do as little damage to the economy as possible. We all know that's a huge challenge, but I think they're trying their best.
Actually, President Trump was very cynical regarding the virus at the beginning, and he said that until April it's going to go away. Was it a mistake to talk like this?
I don't think he was cynical. I think what he was trying to do is calm Americans' nerves, calm worldwide fears, calm markets. And I think as he realized that things were going to spread, he reacted to the information with more openness. I think it is his job to make sure that there isn't a panic. And I think he is doing a very delicate dance and doing it as well as anybody could expect.
In the US, there are little tests being made, and a lot of young people in New York, for example, are being hospitalized. Can the healthcare system in America take care of these sick people?
I think at the moment, in most areas, the answer is yes. But I think that that is going to change rapidly if we don't follow the rules of isolation. My family and I have been under voluntary self quarantine in our township for over 10 days now. I think our township, both the mayor of our town, Teaneck, New Jersey, as well as the Rabbinical Council and others, have started our isolation earlier. And I think that that was very, very important. I think New York City came a little bit too late, but they're doing their best to manage through this. And we, like most of the rest of the world, have a challenge to be able to take care of the sick patients. I think Israel has done an excellent job. I think some of the regions, Saudi Arabia and others, have put in very, very stringent quarantines and isolation rules, in some cases some curfews. And I think every government is trying to manage through this unprecedented, deadly, unseen threat.
Mr. Greenblatt, the US used to be the first among countries to act when a pandemic broke out in the past. This time it seems that America is far behind everybody else. Aren't you afraid to get the virus yourself?
I don't know that we're far behind everyone else. It started here beyond some of the other countries. It started in Asia, moved through Europe, and it is hitting here. It's hitting here in a big way in certain areas, California, New York, and others. I am being very cautious. All of my work has been done over the last 2 to 3 weeks on conference calls, on Zoom. My kids have transitioned to online classes, so I'm not nervous, but I'm also exceedingly cautious. And I think most rational, serious people are being exceedingly cautious. And I have trust in our governments, all our state, local, and federal government, to help us manage through this crisis. But it will only work if everybody cooperates. When I see people in beaches, when I see people looking at the cherry blossoms in Washington, D.C., when I hear about communities that are still going, or at least as of a couple of days ago, we're still hosting large weddings because they thought that they were immune from this, that's what makes me nervous. Everybody has to work together. If we don't work together, by the way, not just in America, if countries don't work together, this is going to just be a vicious cycle. I think everybody has to work together to move past this crisis and to find solutions to help us get through it when it hits again. And I think it will hit again. That's something that everybody should take to heart.
Many Americans, especially young ones, are behaving irresponsibly. And we can see the pictures coming from Miami, from beaches, students partying. How come nobody explains them what is happening?
No, I think they've been explaining it. I have the news on all the time. I think anybody who thinks that it wasn't explained to them is mistaken. I think that they were either not paying attention or they foolishly thought that they would be immune from it, and they're not. Young people can suffer from this, and more so, young people can infect older people. And that's where the danger really lies. If they go home to their parents, or especially their grandparents or their neighbor, they're causing tremendous danger. So I think that we're going to see that change this week. I think young people are now taking it more seriously. But it was disappointing to see those images. I fully agree with you.
Are you afraid that millions of Americans will be dying in hospitals?
I think the hospitals, the healthcare systems, the emergency personnel, the towns, the cities, the counties, they're all doing their best to manage through that. We all need more ventilators. That is a big challenge. I don't know that there's any country in the world that doesn't need ventilators right now who are currently suffering from this. So I would say I'm concerned, but I know that everybody is trying their best to get the right equipment into the right places, and also trying to flatten the curve so that if we stay home, the medical facilities could handle the volume that is expected. If people don't stay home, if the young people continue to behave like that, then we are going to have a serious problem. I think it's not just America that is trying to flatten the curve. Israel clearly is trying to flatten the curve. Israel's Arab neighbors, many of them are trying to flatten the curve. So I think everyone is trying to manage through this problem.
What can be done on the international level to cooperate and fight the virus?
Well, on the international level, we have to cooperate 100%. We have to share data. You know, this is a virus that attacks humanity, and it should set aside all conflict and all politics, and everybody should work together to find the cure, to give the best data, to give best practices on how to manage it, and to work together to find a vaccine. And it's a good example in the Middle East of why we're all in this together. We're all humans. It's attacking all of humanity, and I think this should show the region around Israel that it's time to work together with Israel to find both the cure, the vaccine, and work together to help the population. I'm particularly excited about certain aspects of what I'm doing today. As you know, or perhaps you don't know, I'm a partner in Our Crowd, which is the largest crowdsourcing platform, and they are working on things such as distance diagnostics, artificial intelligence, all the things that try to help the patients, protect the doctors and the other medical practitioners to limit their exposure, but also help the people. And I think that technology could be widely shared. I'm working with an organization that is trying to group together a bunch of real estate to help our government, our local, state, and federal government create testing centers, actually similar to what Magen David Adom has done in Israel. I think Magen David Adom has done a fantastic job pushing these testing centers, which will limit exposure, but also give people the information that they need. And here in the US, we're looking into what they're doing, and we're going to try to share the data with our governments to see if they're willing to do it as well. I'm working with an organization called Windward that is trying to use artificial intelligence and their shipping expertise to try to protect countries' seas and to protect trade. 90% of all trade still comes through ports, and it's important for countries to be able to see and understand the data of what's coming into their country to keep people safe. So all of those are aspects that I think countries should be working on together, because there's no country that's immune from this disease. There's no country that's going to be able to get through this alone.
You yourselves were in charge at the White House with the operations in the Middle East, on the international level, with negotiations. So you know many leaders from around the globe. Do you get calls from anyone, from foreign leaders, for example, asking for help?
At the moment, I'm not in touch with the leadership, but I am in touch with diplomats and foreign service personnel in the region. We're sharing information. I'm sending them as much information as I get my hands on to help them. They're sending me information. I find it actually very comforting to know that everybody, no matter who they are very interested in helping out with no exceptions with respect to anybody that I've spoken to.
The healthcare system in the United States is totally different from the one we know here in Israel. People have to pay a lot of money to get medical care and assistance. How will it take care of the people that can't afford it and will get sick?
So from everything I'm hearing coming out of the White House, it's the intention of the U.S. government to help anybody who needs medical attention for this crisis to be able to get it. I don't know how they're managing it, but I think the expectation is they understand that it is the government's responsibility to make sure that nobody gets left behind with respect to this crisis. Whether they've come up with that system yet or not, I'm not sure. But I know that's the intent, and that's the message that I keep hearing coming out of the White House, both from the president, the vice president, and the entire task force.
Jason Greenblatt, thank you so much, sir, for talking with us.
Thank you so much. Good to talk to you.